Hello, everyone. This is CJ Wolf with Healthicity for another video on the series Deeper Than the Headlines. In this series of videos, we try to go a little bit deeper past those headlines that we often see either posted in a press release by the Department of Justice or maybe the OIG. And today's topic is the conviction of an orthopedic surgeon. So a few months ago, the surgeon was convicted of healthcare fraud, predominantly in the area of upcoding E&M codes. So a lot of you know that evaluation and management coding are those codes, office, for example, office outpatient visits or office new patients, where you have multiple levels. And by choosing those highest level of codes, you receive more reimbursement. And so those services need to be warranted. Well, it was alleged in this case that the surgeon was upcoding, not performing some of the services that he was billing for in those upcoded claims, and then would falsify the records to make it look like he had done all that work. Now, what's interesting in this case is that just about a month ago, he was sentenced to 16 months in prison and a year after prison of supervised release. So a lot of these stories that we share on Deeper Than the Headlines are civil cases where they're financial settlements. This one was actually a conviction, criminal conviction, and the surgeon will be serving time in prison, unfortunately. So, but what I thought was really interesting about this case is the tools that they used to identify this. And one of the things that they identified was that the surgeon was seeing anywhere from 60 patients to sometimes 100 patients in one clinic day. And that's a lot of patients. Theoretically, that's possible, but it starts to get into this realm of, and this concept of impossible days, where it's just so unlikely that that many patients are seen. It seems that something might be wrong, especially when that many patients are being seen in one clinic day and the higher level of codes are being reported, which usually, not always, but usually take a little bit more time. And so if you did the math, and this is what some of the investigators did, they did the math based off of the schedule of when the surgeon was in the office and looked at all the patients and figured out how much time was there. And if there were no breaks, and how many of us do no breaks? I guess that's theoretically possible. But these visits would have been 2 and 3 minutes long. And so, and that's what they were thinking. And so they sent in undercover agents to act as patients. So at least one that we know of, maybe more. But that's what I thought was really interesting is it's one thing, when we do these coding reviews, to look at the medical documentation and say, yes, this medical documentation equates to that code. In this case, it probably would have equated to that code. But the problem is that some of the things documented in the chart did not take place. So for example, when they sent in an undercover agent, this agent went in for shoulder pain from a shoulder injury and was seen 6 different times. And in each of those times, it was just a very short visit, sometimes 3 minutes, sometimes 5 minutes. I think the longest was 11 minutes. 4 minutes. So it was in this range of single-digit minutes for these visits. And the undercover agent noted that no physical exam was done and no medical history was taken. So, and there was undercover video as well. So it's hard to kind of argue that when then the medical record shows that a physical exam is done or that some sort of history has been taken, when the undercover agent knows that wasn't the case. And so I looked at the court records and pulled the exhibit and witness list. They were also calling for real patients as witnesses. They were on their witness list. Probably to ask similar questions about what did this surgeon do when you visited, how long were the visits, those sorts of things. And then, as I mentioned, they were going to include the witness of this undercover agent as one of the witnesses at trial, as well as undercover video. There were a lot of other things, other documents, medical records, and office schedules and clinic schedules and those sorts of things that were included on those exhibit lists. So pretty interesting case. be truthful in what you're documenting. I know it's probably not common for undercover agents to go in as patients, but I have seen other cases as well. I remember a case in the Northeast part of the country, and it was psychiatry, and those are time-based codes where there's psychotherapy codes, and you have to do a certain number of minutes of psychotherapy. And again, it's like kind of this impossible day or this unlikely day where you truly did all of this in the 7 or 8 hours that you were in clinic. So hope you found that interesting. I will include the link to these press releases. And until next time, take care, everyone.